Good afternoon and welcome to the Behavioral Health Department's weekly update for COVID-19. Jumping right into the world numbers, we're now over 97 million individuals across the world who tested positive for COVID and over 2 million deaths worldwide due to COVID. In the United States, we're over 24 million with COVID and 408,000 deaths. We do anticipate crossing the 500,000 mark, likely before the end of our first calendar year's experience with COVID. Very sobering numbers. In terms of California, we're now over 3 million cases and 34,433 fatalities. That compares to last week. We've added 250 some odd thousand, or 220,000 roughly. And have added over 3,000 deaths in that week. We are seeing a slight decline in the overall positive rate in both California and in Fresno, which I'll cover in just a minute. And that is true for the 7 days and the 14 days. So pretty good news about the number of cases per day going down. In terms of Fresno County, we now have 83,591 cases as of yesterday and 968 deaths. January has been our deadliest month in terms of deaths from COVID thus far, and we do anticipate additional deaths before the end of the month. It's quite possible we'll pass 1,000 deaths this month. In terms of hospitalizations, this is actually a couple of days ago. They haven't updated the numbers for today. But much like the cases you heard, it is going down, but it's still quite high. And I really want to emphasize that. We are seeing a downward trend. You could see it on the upper left graph. We have 551 individuals in the hospital with confirmed COVID a couple days ago and 84 in the ICU. That is down from our high of 659 in the hospital and 140 or 49 or so in the ICU. But what's really important to note is that hospitals are significantly over capacity right now. So remember, they've created beds in non-traditional bed locations. And so even though the number's coming down, most hospitals are over 100% capacity for their licensed beds and their licensed ICU beds. And we have at least one hospital in Madera County that has double the number of ICU patients that they have ICU beds. So a real crisis is still happening, and we need to understand that as we move forward. In terms of the tier system for reopening, that got updated this week, and that positivity rate and new COVID positive cases per day per 100,000 population, both are slightly trended down. We're still quite a bit higher than the state number. So I reported earlier the state number being over 9%. We're at 18.3%. And so still pretty high positivity rates for Fresno County, and something we'll have to watch very, very closely. If indeed we continue to see hospitalizations go down, that would be a really good sign that the stay-at-home order that Governor Newsom implemented before Christmas did work, and we didn't see that Christmas surge. But we're still not quite out of the woods yet in that regard, so again, cautiously following those numbers. So where are we at? Case rates appear to be declining, hospitalizations slowly declining, although still over capacity, deaths continue. We're learning more about treatments. Convalescent plasma and monoclonal antibodies are two of the treatments we've talked about before. They have determined those do not work in hospitalized or severely ill individuals who have COVID-19. However, they are seeing some promising results if given early. And in fact, particularly for the monoclonal antibodies, they're providing that in long-term care settings and to individuals somewhat proactively and certainly early in a course of a COVID-19 positive determination, and they're seeing really positive results from that. Even before vaccinations were happening, they were seeing a significant reduction both in the individuals getting COVID as well as how sick they would get with COVID. So that's really positive. We've focused a lot on the vaccines the last couple of weeks, but the treatments are also evolving. We're learning more. Some treatments didn't work in settings we hoped they would, but they are working in other settings. Some have been abandoned entirely, and they continue to explore. I know with the new administration coming in at the federal level, we do anticipate additional funding and push to continue that work around treatments as well as vaccinations. Vaccines do remain critical. Supply is an issue. That's not just in Fresno County. It's statewide, nationwide, worldwide. We're really, really hopeful that in the next week or two we'll get some additional vaccines approved. That would really open up some of the supply chains, we hope, and begin to allow communities like ours to vaccinate at the highest rates they can. We believe right now in Fresno County that we could easily vaccinate 30,000 people a week, but our steady supply is more like 8,000 to 10,000 doses. So we've asked the state for significantly increased doses to be sent to us with the supply chain ready to deliver it. And so stay tuned on that. But again, with the existing 2 vaccines, the manufacturers can only manufacture so fast, so we're really hoping, praying that we can get some additional vaccines approved to provide additional options to get out there. There is potentially going to be a change in tiers. There's been a lot of focus on those tiers. We reviewed that last week. It's possible the state is going to go to a more strictly age-based tier coming up shortly. And so stay tuned on that. We don't know if that would be mandatory or if counties could continue down the path they're going on, but we'll let you know. And then, as I mentioned earlier, the new federal administration coming in has a really detailed COVID-19 response plan that they are hoping to implement. President Biden and his team has a real focus. They recognize that responding to COVID is going to be pivotal to the success of anything else they want to accomplish. And so there's going to be a big push in terms of PPE, in terms of testing, and also in terms of vaccine manufacturing as well as distribution. So they hope to open some federal administration sites, and they're also hoping to incentivize those vaccine manufacturers to increase the amount of vaccine that they're producing. Testing, isolation, and quarantine still need to continue. If you're out there and you're exposed to COVID, you still need to quarantine. If you get COVID, you still need to isolate. Strongly encourage people to participate in testing, particularly if you have symptoms, so that we can follow those precautions of isolation and quarantine if we get COVID or we expose people to COVID or we're exposed to COVID. We also, remember, continue mask wearing and social distancing, even for people who are vaccinated. We're learning a lot. The pace of scientific discovery in regard to COVID, the treatments and vaccinations is just remarkable. And it's really, the amount of money being put towards this is really enabling us to learn at such a faster pace than we normally would. And so we'll find out over time what protections the vaccine really affords, both to the person who's been vaccinated as well as the ability of that person to possibly spread COVID. And so this is one of those we'll need to stay tuned on. But hopefully most of you support the concept that it's a small price to pay to wear that mask and socially distance if we can get out of this COVID nightmare that we're in. So there is light at the end of the tunnel. We are moving forward with vaccinations. Treatments are improving. And yes, there are variants out there that appear to be more infectious at this point, but there's also evidence that the vaccines that have been developed should work against those variants. So it's a little bit of a race against time, getting those vaccinations up to a level that we can achieve that herd immunity and really begin to learn to live with COVID. And so there's hope. And we all need to just stay focused on getting us to that next step. So Our vaccine clinic will take a break next week. Through the end of this week, we've provided first doses to a number of people. The second shots will begin the week of February 1st. And individuals who did get a vaccine shot will get an invitation with a link to register to a clinic to get that second shot, probably in the next few days. And then we'll be looking to plan future clinics to address the needs of the people we serve. We're in the process right now of really assessing and understanding the population that might need vaccines that we serve. We're able to get some of the older adult clients through the vaccination clinic this week, as well as some of the people we serve who are on conservatorships or public guardianships. And that seemed to go pretty well this week. It was a good test. And so we'll be really looking, and you should anticipate, if you work on the clinical side, that we'll be working with our clinical teams to develop strategies and a model for making sure that individuals who, when they become eligible for the vaccine, are able to get the vaccine, and also that we can keep track of that. I always get questions about it. Telework is expected to continue. I'm saying probably, at least for the next few months. March is at a minimum. I will answer this question before it's asked. I don't know exactly what telework will look like in the future. I do expect us to have somewhat of a hybrid system moving forward, but what that means for individual staff is simply unknown. So you can ask me, but I probably won't be able to answer that question for you. A reminder that the county is still offering testing to county employees and their family. Please take advantage of that. Those links go out weekly. And you can take an hour of work time with supervisor approval. I think this went out from Mary Ann Lee in the last week, that we do not pay for holiday or weekend. So if you choose to go to a clinic on a holiday or weekend, that's your own time. That's not county time. There's plenty of clinics available during county time should you choose to get an appointment then, but that has to be coordinated with your supervisor. You cannot take a county vehicle. You can count your travel time if you have the proper insurance requirements on your personal vehicle. If you do not, you cannot count county time for your travel to the vaccine clinic. If you have any questions about that, please refer to the email from Mary Ann Lee or consult with the department's Human Resources Division, and they'll be happy to answer those questions for you. And with that, I will, so the question is, when should we expect an email? She heard my answer. What will happen, just to be a little more specific about that, if you received a vaccine on a particular date, the second dose can be given 24 to 28 days after the first dose, and really any time after that. They do believe that even if you got your second dose 30 or 40 days or what have you afterwards, it would still give you that additional benefit. But we're going to make every attempt to get people their second shot between that 24 and 28 days. Because that time frame, that window of time, some of those days fall on weekends. For some of you, you'll be given the option of 1 or 2 days to schedule your second shot. For others, it may only be 1, and for others, it might be 3 or 4 days, depending on when it falls during the week and what the clinic availability will be. But what you'll receive is an email from DBH Vax, much like you got the first time, which had the links to the available clinics. The clinics that will be made available to you are the only clinics that fit into that window of 24 to 28 days for your vaccine cohort, we'll call it. You'll get that email, you'll pick one of those links, you'll schedule your appointment, and you'll go get vaccinated. I'm presuming and hopeful that all of you who got a first shot will go and get your second shot. The benefit of the second shot is tremendous. I mean, it essentially does double the effectiveness of the vaccine. And so please don't skip your second shot. If you have any questions or concerns, contact us. If there's a problem with scheduling your appointment, please contact DBH Vax and we'll work with you. But the second dose is really what's been proven to provide that 95% benefit. You will not get the 95% benefit unless you get the second dose. So please, when you get that, make it a priority to schedule that appointment as soon as possible and get your second dose. Are people reporting more side effects after receiving the second dose? Not as many people have gotten the second dose of Moderna as got Pfizer, and I've heard mixed results. I've heard some people say if they had a reaction the first dose, they had about the same reaction. I've heard some people say it was a little less. I've heard some people say it was a little more, and some people had no reaction to either dose. And so, you know, that's kind of not the best answer, I suppose, but there's no reason to believe for sure that you'll have a bad reaction to the second dose. There was some information in the news, and I know I got an email about it this week, about some allergic reactions to one particular lot of Moderna. It's kind of interesting, and I think eventually we'll hear more about this, and I think it's quite likely we'll find that it was not an allergic reaction, but I'll tell you about it a little bit. And first of all, I'll say that the lot of Moderna that was associated with this different reaction was not a lot that Fresno County had at all. So none of you got that Moderna vaccine. It's nothing for you to worry about. And what's unique about it is those lots cover lots and lots of doses, right? This isn't like a small lot of 10 vaccines. It's hundreds and maybe even thousands of vaccines in each lot. And the only reactions were at one clinic that had that lot. So if you really understand science, you would immediately question whether or not it was a characteristic of that particular vaccine or something unique to that clinic. Was it the needles that they used, the technique that was used, a prep that they did? The reports are that it was no severe reactions. It was just like tingling or some sort of reaction that was unusual, hadn't been reported before. So there'll be a lot of research on that lot and understanding of that particular clinic, what happened. But I think it's really important to note that even though that lot was broadly distributed across the state, the only clinic that reported it was one clinic. And so I'm not too worried about that because it doesn't make sense to me that it would be the lot if only one clinic had the problem. But they'll research it fully and they'll let us know what they find out about that. I heard some concern from Frontline County Library staff wondering their tier and when they should be getting the option. Are you aware when they might project to be addressed? So there's a lot of confusion about this, and I'm going to be honest with you. There's a lot of frustration that Department of Behavioral Health staff have been vaccinated, and some of our county counterparts who you could argue have frontline jobs and interact directly with the public have not been vaccinated. The tiers were not designed by me or our Department of Public Health. They were designed by a cross-sector task force at the state level with representatives from pretty much every sector. And the decision was made to vaccinate according to the tier schedule. As behavioral health workers, we qualified for that vaccination. It is not my position, nor should it be any of your positions, to debate or justify why we received the vaccine and others didn't. I think every single tier could make a really good, compelling argument for why they should be vaccinated. And the good news is everyone is eventually going to get vaccinated. Unfortunately, we do not have adequate vaccine to vaccinate everyone all at once, and so the state came up with the tier methodology. It is certainly debatable at that level with the people who made the decision about whether or not different individuals or workplace designations should get vaccinated before others. And you know, I've heard arguments from school teachers and police officers and grocery store workers and now the library staff. I am not at all saying that they don't deserve to be vaccinated or they aren't in a job that has an interaction that they should be higher in the tier. It just wasn't my decision to make, and we were following the tier according to the state and the public health guidelines. So, you know, that's pretty much all I have to say about it. Is there any concern that there will be enough supply to deliver the second round? No, there's no concern at all. We have adequate supply right now to give the second round and the first rounds that are planned over the next several weeks. Someone said they got Moderna, feel great, no side effects. Yay. How long will the county be offering vaccines for our staff at DBH? I'm wondering how long I have to schedule an appointment if I don't want to do it right now. We are only offering first doses through the end of this week. Anybody who qualifies to get the vaccine can continue to go to other clinics. So right now the Fairgrounds offers to healthcare workers, Sierra Pacific Orthopedic offers to healthcare workers, United at Central East High School is offering to healthcare workers. So just because our clinic isn't open to first doses starting next week doesn't mean you can't choose to get one. You just won't be getting it at our clinic. I can't confirm that we will offer additional first doses at our clinic. Our clinic is very small in the overall scheme of clinics, and it takes a lot of our resources that are traditionally dedicated to crisis stabilization, inpatient psychiatric, and outpatient nursing and medical care. And so we're going to kind of play it by ear. We will, at some point, as I mentioned earlier, be working towards ensuring that the people we serve get vaccinated. Whether that happens at our clinic or another clinic remains to be seen. That'll be dependent on the volume, our ability to stand up the clinic again, and the availability of vaccine. So if you chose not to get an appointment, you weren't ready to get the vaccine, you still can get the vaccine. It just likely will not be at our clinic. If you end up exposed to someone with COVID after you've been vaccinated, how long after the first dose can you get tested without the test coming up positive due to the first dose? The vaccine does not make you positive. The vaccine does not have COVID in it. It doesn't make your body produce COVID. There's no correlation between a positive test and the vaccine. It is possible that you could have been exposed to COVID before you got the vaccine and you could test positive for COVID. It is possible that you could get exposed to COVID after you got the vaccine and your body has not produced enough antibodies to fight off COVID and you would test positive for COVID. But you do not get COVID from the vaccine. You would not test the positivity of the test has no relationship to the vaccine. And I'll just give you a quick little primer on this. So what the vaccine does is when they examined the coronavirus, and always the very first slide in my presentation, if Brian wants to go back to that first slide, shows you a graphical representation or a pictorial representation of COVID. And it's that little ball with spikes all over it. Those spikes, the little red spikes, are protein. And so what this mRNA vaccine does, it's an mRNA, and mRNA is messenger RNA. Most of us have heard of DNA. That's the building blocks of the genes that we express to have the color of our hair and genetic predisposition to different healthcare conditions, the color of our eyes, etc. And so the vaccine doesn't change your DNA. That's one of the myths out there because people hear RNA and they're like, oh my gosh, my DNA is going to be changed. No, messenger RNA is mRNA. And what messenger RNA does is it communicates with your cells. The DNA says, hey, I want you to produce more blood cells. And it sends messenger RNA to tell your cells, start the production, produce some blood cells. And it really, it's just a little messenger system. And the great news about mRNA is your DNA sends out that messenger RNA, and once it's delivered the message, it just breaks down, it's gone. And so what the mRNA vaccine does is it tells your body to produce that protein, not the spike, not the COVID. It tells your body to produce this protein. And your cells produce the protein, which then your body recognizes as a foreign substance. So you have this little set of instructions that tells your body to produce the protein. Your body produces the protein, and it recognizes it as foreign and says, whoa, get out of here, protein. You don't belong in my body. I don't recognize you. Because your DNA didn't tell your body to do that, the vaccine did. And so then your body recognizes that, and you might get that soreness in your arm, a fever, you might feel a little sick. That's your immune response. That's your body after your body produces the proteins trying to fight off the protein. Get out of my body, you don't belong here. right? And then it goes back to normal business. So then along comes COVID, and that little COVID gets into your body, and your body recognizes that protein. It doesn't know what COVID is, it just recognizes, it has experience now. You taught it, that's a bad thing, that protein. And so it recognizes the protein spike, and it starts fighting it off. And because you had the vaccine, your body has the tools, right? You've given it the tools to recognize it, and when it mounts that response, it's more effective than if COVID comes in and it has to go through this period of time recognizing what it is. By the time it recognizes and begins to fight it off, COVID is starting to do too much work and your body can't keep up with it. So the vaccination teaches your body to fight it off, tells you to recognize it, and gives you the tools you need. You already learned how to fight it off when you learned how to fight off the protein, and it enables you to keep that protein from binding with your cells and teaching your cells how to make more COVID. And so that's what the vaccine does. It's as simple as that. It doesn't give you COVID, it's not COVID, it just teaches your body to recognize a tiny little component of COVID, that protein, and how to fight it off. It's probably way more than you wanted. My apologies. And then I still want to test for sake of my older parents, as I can maybe be asymptomatic. Yes, if you've gotten vaccinated and you're worried that you might have been exposed or you begin to develop symptoms, you should still get tested, because particularly after that first dose, and even after the second dose, it's possible you could be carrying COVID. We don't know that yet. That's part of the research that'll be done. You know, as all of us begin to get vaccinated, we'll learn more and more and more about what that vaccination does in terms of protecting us from getting COVID, from transmitting COVID to other people, etc. So in the meantime, you're going to act like you didn't get vaccinated, and you're going to follow all of the same precautions, and you're still going to get tested, and you're still going to isolate, and you're still going to quarantine. And you're going to remember that the vaccine did not give you COVID. You cannot get a positive test from getting vaccinated, although you could acquire COVID, particularly before you get the second shot. So if you know, it's just like the flu shot. People will get the flu shot and then say, well, that gave me the flu. Virtually impossible. You did not get the flu from the flu shot. It's not live flu that you're getting with the flu shot. But boy, you just can't convince people when that flu happens in close proximity to the flu shot. The day you get the flu shot, you're not protected from the flu. The day you get the COVID vaccine, you're not protected from COVID. It takes a couple of weeks for your body to mount that immune response and teach your cells how to recognize that protein. Same with the flu vaccine. And so with that, and you know, all of these vaccines, when people get sick, get a fever, have achiness or soreness, that's what your body's supposed to do when it's learning how to fight something. That's what vaccines were designed to do. It means they're working. And so a lot of times people get confused and think, well, it made me sick. That's no good. I'm not taking that vaccine. And they don't realize that your body's doing exactly what you want it to do. It's mounting an immune response. It's teaching itself how to recognize the bad thing that entered it and how to fight it off. Okay. Some good explaining. Thank you. I appreciate that. If you have any other questions about the vaccine, I'm more than happy to answer them. I will let you know that not all of the vaccines will be mRNA vaccines. So the explanation I gave would be slightly different, but each vaccine is looking to do the same thing, and that is produce an immune response in your body and teach your body to fight it off. So the mRNA teaches your body to make that protein so you recognize it when it comes with COVID. Some of the other ones just use different vectors or different types of tools to teach your body that response. As new vaccines get approved, I'll do a little explanation of those vaccines as well. Some vaccines, and I went over this a few months ago even, use what's called attenuated or inactive virus. So they find a way to take the virus and take away its ability to reproduce, but they put it in your body as an inactive virus. Some of the vaccinations you get as a kid are like this, and that teaches your body to fight that off. Others use other viruses or other types of tools, and we'll talk about that when new vaccines get approved. But for now, that explanation serves for both the Moderna and the Pfizer vaccine, that both use messenger RNA as the vehicle for teaching your body to fight it off.
You had a couple of questions on your phone, but
Oh.
you may have already addressed them.
Questions on my phone. I think I did answer this. The vaccination for the first dose, I would just reiterate, do not rely on our clinic for that. You can take your ID and go to other places and explain to them that you're a healthcare worker and get the vaccine. You can also communicate with DBH Vax and let them know that you're ready when there's a spot open, and as spots open, we will let you know. It is quite possible we will open up again. I just don't want to guarantee that because it depends on lots of factors that I don't control. And then, and another question about getting it in a timely manner. That second dose will 100%, there's a really good modeling system that the Department of Public Health has where they are tracking at all times how many doses they have in the freezer, how many doses they're giving on any given day. They project out over time how many they need 4 weeks from now when they're giving that second dose. And they know not to overcommit first doses if it puts the second doses at risk. I've seen the modeling, I've participated in the planning. I'm 100% confident that we will have second doses available. So I hope that gives you some reassurance, but feel free to hold me accountable to that, I guess, in a couple of weeks. But again, you should get those appointment invitations over the next few days, and hopefully once you get that appointment scheduled, it will give you a little more reassurance that I'm telling you the truth. Okay, I don't think I have any more questions there, and no more questions online. So I'll be back next week. If you have other questions in the interim, you can email myself or Tina Young, my assistant, or you can hold them till next week and I'll answer them as well during that time. Let's cross our fingers, say our prayers, hope that in the next week we get more vaccines approved. It's quite possible. The two that likely are to be approved are AstraZeneca as well as Johnson & Johnson are the two most likely next vaccines to be approved. And so I'll be prepared next week or in one of the following weeks to tell you a little bit about how those vaccines work. So stay tuned, have a good rest of your week, hang in there, there is light at the end of the tunnel. We're gonna get through this, we're gonna get through it together. Thank you.